Welcome to Next Gen Parenting. I want to talk here about two major problems or challenges that the parents are facing right now. Number one is addiction, second one is about communication. What is addiction all about? It's a compulsive behavior or getting excessive use or maybe getting excessive intimacy to one person or maybe few substances. For example, it could be an alcohol or maybe drugs or maybe pornography, or getting intimate relationship between friends, a group of friends, and so on. These addictions are bringing so much of negativity and hampers the progression of our children. So we need to be mindful about all these addictions and see how can we detect them and what are the ways we can resolve them. So how are we able to detect these addictions? Number one, see that if there is any odor or bad odor from the skin or from the mouth, that is in their breath, if you can feel that bad odor, then something has to be taken care of. Also, see if their eyes are red or the discoloration of their skin or maybe the lips and so on. Third point is you can also see if they are too much into internet, or maybe they are coming home late, or maybe their timings are not scheduled the way they were earlier. Number four, see if they are missing their classes or they are bunking their classes. If that is there, again, we have to be mindful about all these symptoms. Okay, now if we find these symptoms in our children, then how can we resolve it? Number one is talk to them openly. Tell them ask them what exactly they feel. Let them express openly about their fear or anxiety or what is leading them to these kind of addictions. Number two, seek the help of a pediatrician, a psychiatrist, or maybe a psychotherapist, or sometimes even a social worker can do it. See that they come up with some solutions and you will be able to take some actions. However, we need to take serious action here. Secondly, to talk about our communication. Communication is something that plays a pivotal role in parenting. Both verbal and non-verbal communication are equally important. How is that? Usually what happens is we are not able to understand the way we speak is causing so much of damage in children's mind. So I want to highlight these things here. Small changes can create a lot of differences in our lives. So why not go for it? The first thing is small words of affection or small words of affirmations can create a lot of positivity in the child's mind and in his energy. So if we tell them how amazingly you have done it, how do you feel about it, or what have you done, this is really wonderful. When you say that, automatically the child's energy is boosted and he feels like expressing what his feelings are when he is doing that particular work, maybe a small artwork. Wow, this is a great art. What did you feel when you were drawing this, or what did you think of when you were drawing this? When you ask that simple question, the child feels like answering many things. He gets related to all that thoughts that come up with his artwork. So it's our duty to create an opportunity to speak. It should not be a monologue. It should be a two-way communication. Only then the bonding will be stronger. Secondly, we also have to acknowledge the feelings of the child. For example, we often say this when the child is really low, feeling very low. We say usually, why are you crying? What is the point in crying? Or such a silly reason, and you want to lay down or you want to create this mess. Why are you doing this? Are you a small child? So when we ask all those questions, the child feels that this person who is talking to me, it could be a parent or any relative, but he feels that this person is not resonating my pain, or he doesn't feel my pain. So let us avoid these things by asking certain questions, or maybe we can also help the child by asking him, how can I help you, or how can we turn this situation in a better way for the next time, so that next time we will not have this kind of issues. So when we say that, the child feels like, yes, I am able to cope up with that situation when my father is there with me, when my mother is there with me. So he feels like overcoming that situation bravely. Third thing is listen to the child very clearly. Let him express as much as possible. Whatever he has to vomit it out, let him vomit his expressions, his emotions through words. let him do that. And please do not interrupt in between any of the time when he speaks. Let him just complete his talk. Only then we can speak and give some suggestions. Apart from these, we cannot give advices there, because the child is not in the receptive mood to listen to our advices. Lastly, what I have to say is avoid shaming the child in public. Do not blame the child or criticize the child, but let him, in maybe in the confidential manner, we can ask them to change their behavior, or maybe we can ask them, when we ask them secretly, or when we tell them to do this not in front of any others, we just tell them secretly about all that. What happens is a child feels like, yes, my parents are really caring about my dignity and my honor. They respect me a lot. And that's how he becomes receptive and he tries to change his behavior. So we need to be mindful about these two challenges that parents are facing today. So let us know in the comment section what are your challenges, so that we can come up with some other videos.